as I'll ever be.
Clerk will call the roll. Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Dickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constituted quorum.
Thank you. Our invocation today will be delivered by Elder Carl Blow from the Covenant Life Baptist Church in Fort Worth. Sir, thank you very much for coming out today. After our invocation, please remain standing for our pledges.
Heavenly Father, we thank you once again for this privilege, this opportunity to come before you, calling you on your holy name. We thank you for your goodness towards us this day, Heavenly Father. We thank you for the power of your Spirit that you've given us, that we may walk pleasing in your sight. We thank you for the work you've done for us on Calvary through your Son, Jesus, who suffered, bled, and died. Rose on the third day that we may partake of the tree of life. We just thank you for your goodness. And Father, we thank you for this opportunity, this privilege to bring our petition before you this day. We just ask you to bless everyone in this room, Heavenly Father. We come this day praying your blessing on these men and women, Heavenly Father, who had a heart, Heavenly Father, and a desire to be in your service, to serve your people, to serve this county, to serve our communities. We ask you to look after them, Heavenly Father, to continue to bless them with health, Heavenly Father. Give them the wisdom they need, Heavenly Father, to do their work, and the discernment they need this day, Heavenly Father, that they may serve without bias and make the right decisions for all the people who put under their care, the people they represent. We pray that you bless their health, bless their homes, bless their families, Heavenly Father. And Heavenly Father, we pray that the decisions made here this day, Heavenly Father, be the right decision. We pray that you give them a heart to stand for what is right, even though these times right is not the right. It's not the popular thing to do, Heavenly Father. And we pray that all decisions made in this room, Heavenly Father, will be a blessing to the people of the community, that they may grow strong and progress. In Jesus' name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, sir, for coming out today. We appreciate you. Lisa.
Good morning, Judge,
Welcome.
Commissioners.
Good morning, Lisa.
So today we have several, and I mean more than two, agenda announcements to be presented. First, we will be pulling agenda item under Facilities 8G1. This item had some contractual issues that we are fixing now, and we'll bring that back next week. Under Public Health, item 8I2, we are going to also hold that item for 1 week. And in your red folders, you will find a amended court communication under purchasing for item 8J1. This was simply a breakdown of the fiscal impact. Nothing really changed on that, but that amended court communication is in your packets. And as we have done in the past, we're going to take things out of order. We're going to move our briefing item up for the Arfa and the review of the IEM consultants. That presentation will be first, and then we'll take our public health update next. And Judge, we have 4 audience participations regarding the mask mandates that we may want to take after the public health update. Otherwise, that's all we have.
Okay, court members, you have before you the minutes of our special called meeting of August the 9th.
Move approval of the minutes of August the 9th and the regular minutes of August the 10th.
Second. We have a motion and a second to approve the minutes for August the 9th and 10th. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Before we get to employee recognition or catching up, are there any announcements that anyone would like to make?
Yes, I do have one. I would request that we adjourn today's meeting in honor of Dr. Maxwell Scarlett, longtime community member in Tarrant County. He passed on July 31st. I had the honor of working with him through our membership in the UT Arlington African American Alumni Association and the broader one. He actually made history in being the first African American to graduate from UT Arlington in 1966. So his service has already, it's passed, but I did just want to be sure to recognize him and his family. So that's all I have.
I support that. Dr. Scarlett was an accomplished physician in his own right, but he was a member of a family of physicians, the Gwynn family, that served this community for decades and decades. So it's appropriate that we should recognize him in this way.
Thank you.
I would also like to announce that we all are aware of the pandemic book, which our county clerk produced and put together. In addition to the ones that she got that she's passing out to libraries and to different places around the county, we had printed about 1,300 books for anyone who was interested in purchasing a book. They're in my office, and I'm ready to get them out of my office. And so there's two ways that occurs. One, you come in and bring a picture of Jackson printed by the federal government. And the other is if you have an office and you feel like the public coming in might be interested in purchasing books, then you can check out a box. And when you come back, you will either bring 14 books or you'll bring $280 or some amount between that and that. I'd love for as many of y'all where you have the public coming in who might be interested, or employees, so certainly commissioners, if y'all would be interested, if you will see Teresa in my office and just make arrangements to check out. Now, there's 14 books in a box. And I'm just going to tell you, by the time you put 14 books in there, it's not the lightest of things, so don't think you're going to pick up 3 boxes and just walk them down to the car. You may want to have a little assistance in doing that or looking at that. But for those of y'all who are interested, Chelsea, tell me when I screw this part up. I think that we would like for you to, you're welcome to go by the office. We would like to kind of make it between 10 and 2. But at the same time, if you're in the building and you want a book, bring by a picture of Jackson. We're not taking checks. This is a cash-only deal. So if you don't have cash, then go get some from the credit union and come up with a $20 bill. So we're going to be doing that until we sell out of our 1,302 books. So it's a great book. I would encourage everyone to get this. Mary Louise, y'all did a great job on this. Lisa had some great pictures in the book. So please, if you've got a chance and got a moment and you would like a book, please stop by. And Wendy, if you want them in the tax offices, commissioners, if you want them in your offices, however, wherever, please feel free to stop by and pick those up.
I already bought 11 myself during the auction.
Good, that's great. We sold 198, by the way, through the auction. And we've already had some that have stopped by to pick them up. Next is the employee record. Commissioner Fickus or Johnson, did either one of y'all have anything? No. Okay.
And I don't either.
Well, I figured, when you spoke at the end of Devin, I figured if you'd had anything else, you'd have just kept right on going. Now, you did have an Alzheimer's event this weekend.
A very successful event. It was an in-person event. A lot of valuable information was passed, and we look forward to doing it again next year. Had a good crowd, and they masked up.
Next is employee recognition, and these employees represent people from November and December of last year who were celebrating 25, 30, 35 years with the county, and we obviously didn't get an opportunity to recognize them at that time. And I will tell you that I'm kind of approaching today, and I'm not sure who's going to be here and who's not. So I'm just going to call the names, and if you're here, then hopefully I talked with you. And if I didn't, then I may ask you a couple of questions, and not just because I want to kind of see what's happened in the last few years. The first person I have is George Ateek from CSCD. He's a mental health supervisor, and I don't think he was going to be able to make it. Is he here?
I don't see George, no.
Okay, so that one's down. Next is Thomas Chinald, and I'll bet Thomas is here. There's Thomas. He started out as a probation officer and was there for about 5 years, and then he moved to domestic relations as a probation counselor, and he's now the assistant director. I wish Jack was here. And you'll understand. I asked him memorable moments. He said, yeah, and he didn't have to think long about this one. He said, I had once the opportunity to work with 2 cousins, which both had kids from the same woman.
Ooh.
Well, that's what he said. He said, I asked, are you from Arkansas? I asked him what he liked most. He said it was the people. He said the county has been very conservative as far as the revenue, and he said, I've heard it said many times, we take very personally how we spend the taxpayer dollars. And I told him that certainly that was correct. He said, I have really appreciated the opportunity to work for the county. I see you brought a couple of people along. I recognize them. You want to introduce the folks you brought with you?
Yeah, this is Clint. Introduce me. He's the director of enforcement department, and this is Donna Larson. She's the director of our department. I'm the assistant.
Yeah. Donna's, what year? How many years have you been with the county?
44.
Yeah.
Oh, my goodness.
We'll catch you next. Well, I don't know.
No, you won't.
Well, wait a minute. I don't want to take anything away from you, Thomas, but stand up. 44 years.
Yes, sir.
This year.
September 7th will be 44.
Wow.
And you're telling me you're not going to be here, I think, September of next year.
I'm not.
Well, thank you, Donna, for your 44 plus years of service to Marion County. And Thomas, thank you for your it's between 25 and 26 years of service. Thank you.
He's also a veteran, sir.
Thank you for your service. Thank you very much for your service. Daryl Gamboa. Yeah, wait a minute. Okay, just a second. I got to get to you. I think. Okay, you just came back. You had been off work, and you just came back this morning.
That's right.
And unfortunately, I got caught in some meetings, and I didn't get a chance to give you a call this morning.
Well, that's all right.
Well, you say that now. Come on down. Yes, sir. And I'm sorry. It's my fault. It's purely my fault that I didn't get a hold of you sooner. But I just want to talk with you a little bit. Did you start off in the IT department?
I did. It was data services back then.
Data services. And what were you doing when you first started off with the county?
We started off the Data Services Training Center. Mary Blassingame and I were the instructors.
And then where did you go from there?
Let's see. Then I did some support for a short while downtown in the courts and different departments. And then by 1998, I went to Precinct 2 and did support for those sub-courthouses and buildings in the southeast of the county.
So you were the IT representative in those particular areas
Yes,
from that
sir.
standpoint. What happened after that?
Well, let's see. Y2K happened.
Everybody got prepared for now, and maybe the reason we didn't notice it is because of the IT, but it was, I think everybody thought it was going to be a big event, and at least in Tarrant County, it was a non-event.
That's right, sir. It was all Data Services responsibility to make everything work right.
And you did. We thank you very much for that. Okay, that's 2000. We only got 20 years to go.
Well, let's see. Lots of department name changes. Let's see. Lots of computer problems over the years, printers.
Where are you working now?
Let's see. I have an office at the Arlington Subcourthouse, and, well, let's see. I did get moved out of my nice office in the Arlington Subcourthouse.
Yes.
It's that commissioner out there. I'm just telling
No,
you.
it was
all
the
fault of that commissioner.
it was the previous administration.
Oh, it was the previous administration that did this. Okay.
I'm trying to get Daryl right now.
That's right.
He does a great job.
So, over the 25, 26 years, is there something that just as a memory really sticks out?
Let's see. It was kind of cool starting off in the old civil courts building, in the basement, teaching classes there, starting off a new program. It's been a great 25 years working here. It's the best job. Everybody's always happy to see me.
Because something's broke when you're called. What do you like most about working for the county?
I think it's the people. You can't beat a reception when you walk into an office and everybody goes, Daryl!
Is there anything else you'd like to mention today?
I'm very proud to have worked here at the county. Everybody always says it's the people, my coworkers, the people that I work for. It's an amazing job, and I'm so thankful to have had it.
Daryl, we really do want to thank you for the 25 years plus that you've given us. And for all of you out there, this is the way the phone calls go. And they're fun. And usually I try to catch people on the weekends because that way they're not caught up in the stress of the day. And we have conversations just like we had here. On the memorable moments, sometimes we really get to laughing because some of them will tell memorable moments that unfortunately can't be told. And it used to be a lot more in the beginning, and then they realized that sometimes I told the stories, so they quit telling the stories. I'll just get this laugh, and I can never coax out of them what caused that laugh. But Daryl, we thank you again very much for your 25 years, almost 26 years of service now to Tarrant County. Thank you.
Thank you, Judge.
Tabitha Stevenson. Now, aren't you glad you answered the phone? Tabitha is in the Criminal District Attorney's Office, again, 25 plus years. She started out in the DA's office as the first file clerk in the Arlington office. She got promoted 3 months later to secretary, then to bookkeeper. She then moved over to the county clerk's office for a while and then moved back to the DA. She got promoted and is now a legal assistant in the criminal district attorney's office. Memorable moments. And this is what you hear and what I hear all of the time. She experienced a real loss. And she said the compassion that she received from one of her supervisors when she did that is something that she just can't say enough about. It was something where she was going through a difficult time, and that supervisor was there to wrap her arms around her and just to help her get through it. And so, that was the thing that she remembers more than anything. When I asked her what she liked most, she said, it's an opportunity to serve the community. She said, it has been a great fit for me and for my family. And she said, I've been able to work with officers to help them get their work completed. Tabitha, thank you so much for your years of service to Kentucky. Next is Dana Victorson. There he is, okay. Started out in juvenile services as the intensive juvenile officer, and it's called ISP, probation officer. Then to the family partnership program, and he spent 16 years there, and that's kind of a partnership with mental health. Then he went to the court unit as a probation officer. I asked him about a memorable moment, and this is what I often hear from folks, especially in the juvenile services area. He said, there was a case where we had a kid that was just totally out of control. He wasn't going to school. He was, smoking marijuana, was just in an awful lot of trouble. And they worked with him, and about a year and a half later, he said, I got a graduation announcement from the kid. And he said, I knew that we'd been successful. And again, not only had they been successful, but the kid realized what a difference that they had made in his life, and he got back on the right track. He said, I have absolutely loved the people that I've had a chance to work with. And he said, what I really love the most is being able to help families navigate through the system, through the court system. Dana, thank you so much for the 25 plus years of service you've given to Tank County. Next is Charles Wiseman. Is Charles here? I don't think he was going to be able to make it. He was on vacation. So when you see Charles, thank him for his 25 plus years of service. Next is Mary Jo Gutierrez. I didn't think she was going to be able to make it down. Followed by Judge Molly Jones, who was not going to be able to attend. She's busy in court today. 30 years. Mary Jo, as well as Molly, Judge Jones has 30 plus years of service. Then next is Kendall Novak with the District Attorney's Office. There he is. Started out in the Sheriff's Department with Lon Evans. Moved to Patrol and Narcotics, then to the Check Department. Is now in Special Crimes. And I think what you said is you do the forensic on cell phones. Yes. Memorable moments were was first the helicopter crash, and he was one of the first, if not the first, to the scene on that particular deal. And then just watching people retire over the years, he said, what I like most are the great bosses, the sheriffs and the DAs that he's had a chance to work with. He said, this is a place that I could recommend to anyone. Has great benefits. It's just been a great place to work. He said, I've loved every bit of it. He said, I never looked at those retirement benefits for the first 15 years. But after that, they begin to, mount up, and you begin to kind of check that little website every once in a while just to make sure they hadn't missed anything. He said, seeing folks come here, and then he's worked with them for many, many years. When we talked almost 6 years ago. He had a son graduating from high school and entering at University of Texas at Dallas. He had a daughter that was going to start tech in the fall. So today, the son has graduated with a master's in accounting, went to New York and worked for KPMG, is now waiting for Norway to open back up because he's been transferred over to Norway and will continue to work with KPMG. His daughter is graduating with a doctorate in pharmacy. Just got married last month. He talked about the trip that they went to up in Montana near the Glacier National Park and how beautiful it was up there. He said, I've been very blessed, and it looks to me like you have your biggest blessing sitting next to you there. Maybe not. Maybe not. Uh-oh. Well, see, that's what I get. I should have looked and seen the little lanyard around her neck and said, no, that's probably not his spouse. But why don't you go ahead and introduce the person that came along with you in your work?
This would be my supervisor.
Now, see, I understand that. I have, and my wife understands that very much so. That we have a wife, and then we have a work wife. So, thank you so much for your 36 plus years of service to Tarrant County. I can find all kinds of instances to put my foot in them. Now, we have 3 more folks who are celebrating 35 plus years of service that weren't able to make it today. Tracy Pelly with Facilities Management, Robin Worthy with HR, and Andrea Zeton with the District Clerk's Office. Now, we're going to do Andrea and Robin probably in the weeks to come, and maybe Tracy if I catch her in court. Between now, in a couple of months, Tracy will be leaving and retiring from county service after 36 plus years of service. So let's give all these folks a big hand. We got refreshments, 504C. Waller must have already headed back there. So he's probably got a head start, but again, thank y'all so much for your years of service. Okay. Thank you.
Congratulations, you two.
What do you congratulate them on? I would move that we receive and file the employee recognition.
Second.
We have a motion to second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We'll wait just a couple of minutes, Commissioner. I will be back. It really is a lot of fun. It's time consuming, and a lot of times I'll come up here thinking, I've got 10 or 15 people that I've got to try to get a hold of, and it usually goes pretty fast. Sunday before last, everybody I called answered first time. This Sunday, nobody. So I spent a lot of time yesterday also trying to do that. But, it is a whole lot easier to catch them when they're a little bit relaxed as opposed to when they're in the middle of work. I have called people at work and find that their fellow employees have a tendency to make fun of them while they're on the phone, if they realize that they're on the phone to me. So I'll hear them kind of sniping in the background. Board members, you have before you the consent agenda.
Move approval of the consent agenda.
Second.
We have motion and second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Lisa?
Your Honor, if we can move into the briefing agenda and take item 11C, the discussion on ARPA, and I want to ask for Kristen Camarino to come forward and introduce that item.
Good morning, Judge and Commissioners.
Good morning.
As you all know, we have been discussing at length ARPA and also our community needs and resources assessment. And I'm happy to say that our consultant, Innovative Emergency Management, IEM, is here today to give you and the audience an overview of the project, next steps, and an idea of the timeline for the assessment. Innovative Emergency Management has vast experience in emergency management, disaster recovery, and has and is currently doing projects in our region as well as around the country, many of which are directly applicable to our assessment. Katie McCoy with IEM is here today, and Katie is one of the IEM consultant team who will be working with us over the next several months, and Katie is also a Tarrant County resident. So happy to ask Katie to come present today.
Good morning.
Good morning.
Morning, Katie.
Good morning. Thank you all for having me here today. As she mentioned, my name is Katie McCoy. I'm with IEM. If you can go to the next. Oh, I have it. Just kidding. So a little bit about IEM. We are a minority female-owned business. We've been in business for over 36 years, and in that time, we've assisted over 200 counties in a variety of disaster preparedness and response projects. We've also helped our clients distribute about $270 billion in recovery funding, as well as COVID-19 funding. And as you can see, our customers are pretty varied, but we do support some of our local cities here, such as the city of Fort Worth and the city of Dallas, as well as the Council of Governments.
What have you done for the city of Fort Worth?
Recently, we wrote their after-action report for the mass casualty incident and the winter weather event that we had in February. So with this project, we're going to be looking to create some actionable strategies and program coordination for the ARPA funding that Tarrant County is receiving. And by doing that, we'll take into consideration the real-world impacts that Tarrant County has experienced, as well as engage the community and ask for their input, including underserved and underrepresented communities as well. And then we'll take those priorities that have been set by the county and align them with what's eligible under that ARPA and FRF grant funding. Prior to IEM coming on board, the county had actually done significant work through county leadership work sessions. So we're actually taking the work that they've put in place already, and we're going to let that inform, and we'll incorporate that into the work that we do moving forward. As a result of those county work sessions, you all have identified 4 main areas of focus, and that's the prepare for the future, improve public health and wellness, revitalize the economy, and strengthen the community. As a result of this project, we'll have 3 main deliverables to the court and the county. The first being the interim report, and that'll be a compilation of the needs assessment that we're conducting, as well as some GIS information that we're collecting for the county. We'll create a pre-pandemic profile for the county. We're also incorporating the needs assessments that have been done by local organizations. We'll create a resource assessment, so what money is available to the county, what money have you received, and what money will you receive moving forward. And then we'll also include those immediate community needs. We know that there have been significant needs that have been already identified, so we want to make sure we incorporate those as well. The second will be the final report, so that'll be the final report where we'll have the community engagement process incorporated into that and any feedback that they give us. And we'll do that through surveys, workshops, and roundtables with community leaders. And then finally, the recommendations. And that'll be the prioritized list of what's eligible that the county has identified. And we'll use, we'll have the principles for the project selection included in that as well. I think it's important to note that this is all running on parallel tracks. So I know that there have been some programs that have already been established or some funding that's already been pre-identified, my understanding of that. Our reports, our interim and our final reports will not preclude any money from being spent prior to the issuance of those and the acceptance of those. For those needs assessments, I mentioned we are doing some GIS info compilation, so we'll create that pre-pandemic community profile so we can identify what was impacted through COVID-19 for the various sectors. But we're also looking at some social vulnerability indices and some other metrics to identify communities with the greatest need as well. So that interim report, we owe that to you by the end of September. We'll include that GIS information, the preliminary needs assessment, the resource assessment, and immediate needs for the community. Following that, we'll start the public outreach and engagement, and we'll create customized surveys for community and faith-based organizations, businesses, and residents. And this will be varied depending on the communities that we're reaching out to. And what we've asked the court and the county administration office is to help support us in providing a list of trusted community leaders and messengers to really make sure that that's spread far and wide. We'll also conduct workshops for regional collaboration with our local jurisdictions to make sure we're not duplicating efforts. And then we'll also conduct roundtables to develop sector-specific strategies for the different sectors within Tarrant County. So this process, all of that information will be considered, and then we'll look at the inputs. So what resources are we investing for those priorities? As a result of that, what activities will we need to engage in, whether it be building new infrastructure, assigning staff to it, developing a new program, and then who does that really benefit as a result? Which sector within the community will reap the most reward for that? And then what are short-term and long-term outcomes for that? So is it a short-term outcome or is it a long-term outcome? But we want to deliver smart, measurable metrics for you all to continue on. The final report and briefing, we owe that to you in January, so that'll be a compilation of the data analyses and the needs assessment. It'll outline our outreach approach and any feedback we received. It'll also capture the findings from the research that we conducted, as well as provide the data and justification for the money that we spent. The final strategy and recommendations, that'll be the prioritized list based off of what the county identifies as immediate needs or long-term needs. And we'll align those with eligible uses for the ARPA and FRF funding. And we'll align that with the community needs, and we'll create positive, measurable outcomes for Tarrant County. And with that, that is all I have today. Thank you all very much, but I'll open it up for questions.
Questions?
Just a comment. I had a wide-ranging and very frank discussion with the IEM team, and I think we understand each other. We will see. The proof is in the pudding.
I would hope, we talked in our conversation about being here as frequently as possible.
Yes, sir.
And, if that means you're sitting here at every court meeting just to hear what discussions are had, but also to be able to respond if we have questions about what's going on. The first thing that's going to be done by the end of September, as I read it, you talk about surveys after that, but there are going to be a lot of conversations with some of our partners, some of the social agencies, whether it be Child Care, United Way, foundations, but also with the cities, with the schools. Those will all occur between now and that end of September report.
Correct.
Okay. And I just think it's very important to, at least hopefully, as I've said before, we got probably close to $2 billion coming to the county, not to our particular form or entity of government, but to all of the entities and different social agencies that are going to be getting money probably in the next 12 now months. They've already gotten a lot of that. And I just want us to see if we can focus on having some common goals in place as we go through the process.
I think we'll be
But at the same
successful.
time, we're not going to, as you said, we're moving forward with certain programs, and we will continue to move forward and not just wait to spend the money until all this is done.
Correct.
Judge, in our meeting, my concern was the timing of the final report. I thought that was, considering what happens after the final report, I don't see us dispersing money until almost a year after we received it in May, and that concerned me. So I don't know whether y'all have gone back, looked at that, seen if you can do any improvements over the end of January date. It was a long time between September and the end of January, so I hope that you're able to do that.
Thank you, Commissioner. So to that point, I did mention this is running on parallel tracks. So we won't be waiting until the end of January for the county to be able to release or spend any of that money. We fully anticipate for programs to receive funding prior to that January date.
Okay.
Any other questions? Katie, thank you very much for.
Thank you all very much.
being here today.
Have a good day.
Judge, if we can now move into item under briefing 11A, Dr. Tanasia will come up and give a briefing on current and emerging health issues.
Good morning, Your Honor, and members of the court.
Penny, good morning.
Back again with our weekly briefing. No change in trend, unfortunately. We're still heading up. There's not a real slowdown in the data, and I'll show you some of the charts. I always try to stay optimistic. Well, here we will roll over, but it keeps going, unfortunately. 288,000 cases and 3,710 deaths in Tarrant County. I think we're reported another 1,300 or so cases this morning, and it'll be showing on the dashboard here in the afternoon. Hospitalizations are continuing to trend up. 968 people in Tarrant County hospitals confirmed with COVID. That's 21.86% of our hospital capacity. Our trauma service area E, yesterday was showing 2,743 people in the hospital. That's 17.89% of the 19-county region hospital capacity. And of note, we're now 7 days past the 15% mark. But I think the options are very limited, as the judge spoke a couple of weeks ago. But here we are, all the information, and then, of course, the trend is clearly still going up. The chart on the left is the epidemic curve that we usually follow. That's the curve we kept telling people to flatten out with all the public health measures. Clearly in an uptrend. The last bars take a while to fill in as the data gets reported, but we're still in an uptrend. What I keep hoping for is the one thing that the R0 has slowed down to below 1. But again, all of this is data that has already happened, right? So as you all understand, this is a pictogram of what has happened. It's not a predictor of the future. And our community's actions are what drive the future. So I'm not quite sure where we will go, but currently all indications are we're still going to be going up.
We have not, according to your data, the data that you send to us each morning.
Right.
We have not reached a peak in Tarrant County. Your daily numbers keep getting larger and larger by the day.
Yes, sir.
And that is extremely concerning.
It is, and as you can see, I mean, I always try to find silver lining. There's a flattening of the curve on the top and this and that, but again, what's happening in our community? Schools are opening. This is the first week. Colleges are opening. Everybody's back to full normal activities as if COVID does not exist. But here we are. It's roaring in our community, and we're spiking fairly hard. Again, I can only appeal to the common sense of the people. There is a huge outbreak in our community. Wear a mask, get vaccinated, avoid unnecessary large crowds. There's nothing else we can do at this point to educate you any further on this issue. We know the tools. We know how to beat this down. We don't have the policy tools to fight this, but education is strong. We just need to work together to get over this pandemic. And those tools, mandate or not, they work. They work. So get vaccinated. We have plenty of vaccine out there. In fact, there's a new update out that people with underlying health conditions that are immune compromising, for example, if somebody's got a transplant that they had, or they had cancer chemotherapy, or have HIV or some other medications that they take that may lower their immune system, now they can take a third booster dose. So it's available at all providers. There was a confusion to start with on last Friday, but it's been clarified that all providers, including public health, will be giving out that third booster dose. Caution though, don't everybody rush out. Those who received their vaccine and they're part of the normal public, they don't need to worry about at this point for a third booster. It is only for those limited circumstances. But there's also news out there that companies like Pfizer have submitted their study data for general public to receive their third booster dose. So hopefully it will come here in a short while. But for now, those that have severe underlying health conditions that compromise their immune system should come out and get their third doses. Of course, check with your doctor first, because these are very complicated matters. You don't want to just walk in without talking to your doctor what the implications may be for you. So talk with them. If they say it's okay, either you can go to them or you can come to a public health clinic, you can go to a pharmacy. Vaccine is available in ample supply. Let's get it. Let's get it done. And then those that are on the fence and have not been vaccinated, now would be the time, folks. Let's get it done.
Vinny, will you talk about the situation with the availability of pediatric ICU beds?
Yes. So I don't have that on the slides, but we've come to a point where we had 0 beds in Tarrant County last week at some point. In fact, in the metro area, that was the situation. It was widely covered in the news that we're critically low. There was news coverage about kids out of North Texas, I don't know if it was Tarrant County or not, being evacuated to Oklahoma or some other neighboring states because there was no hospital beds. So the situation has become dire in that regards, that there were pediatric beds in general were full, and then ICU beds were full. But as you know, that data ebbs and flows throughout the day. Kids get discharged, they have more staffing available, so the more beds become available. So it's a floating number, but we're still in the high 90% range on both of those. That is critically low. Things happen. Kids are born with congenital illnesses, heart issues. There's a major accident. We need that capacity to be able to handle other things other than COVID.
Vinny, let me just stop, Commissioner. I've talked with Rick Merrill and with Nancy at Cook's several times in the last week. What they've said is just as Vinny indicated. They go from 0 beds to maybe 1 or 2. Mm-hmm. They have a long line of people in their emergency room waiting for beds. RSV is up, flu is up. They're, in most of the times that I've talked with them, 100% of the people, of the kids in ICU are kids that were not vaccinated.
Yep.
And that has been the case among all the major hospitals. High 90% or 100% of the people in their ICUs have not been vaccinated. So I think all of them. Now, what Cooks has said is we will never close. We will transfer people to other facilities that can take them, but we will not close. We will be there to. We're not going to send a family away who has a child that needs care, and that's what they're saying, and that's what they're going to do.
Absolutely, and again, they've done a commendable job throughout the pandemic. I mean, our hospital systems have been resilient. They've tried to stay above and ahead of the curve on what's coming towards them. So no doubt in their abilities to manage all of this. But as a community, do we really want to make our hospitals that full where if I have to go and seek emergency medical care, then I have to wait a few hours in the waiting room or in the hallway? Because that's happened in other states. I mean, if you
More
just
than a few hours.
Yeah, well, yeah.
In the hallway. There's
Right.
some of them
Yeah.
spending up to 48 hours. Some
Yeah.
of the hospitals have actually gone to identifying the hallway as a room because they've got to know where the 20 or 30 patients. They've got to know which patient and where the patient is located.
Yes.
And in many of them, it's in a hallway.
Absolutely. So, I mean, we can talk about it all day. The point is, this is not one entity that can fix it all. Hospitals can treat sick people. But us as a community, working with your local health department, can actually prevent this from happening. All I ask is everybody work together. I know there's been different sides picked on issues. Let's temporarily just forget that and work together. We can beat this down. We've done this several times. We have better tools now. We have the vaccine. We know the mask works. We know that social distancing works. Let's get it done. Bring this curve back down, and then we can go back to taking our own side. That's okay,
And that's, again,
Yeah.
why I've said I strongly am recommending masks. Whenever I am walking from my office to here or anywhere else, I have the mask on. When I go into any store, when I go into a restaurant, any place like that, I'm now wearing the masks again, even though I've been vaccinated. And I strongly recommend that we all do that. And, I would strongly recommend that y'all out in the audience wear the masks.
Thank you. All right, so quick national trend. As you can see, the trend is up nationally. We've surpassed last July. We're not there at what we saw during the December holiday timeframe or early January. But if you look at the chart on the right, where most of the hot spots are, it's in the southern United States, Texas, Alabama, Louisiana, Florida, all of these, southern states. And about 8 or so of the states out of the 50 are pretty much leading the surge. We're adding most of the volume of the cases for our country. So all of us together have to get it done and do these things that we've talked about, and this will subside as well. RSV situation, got to bring some good news, seems to be leveling off. We've kind of had a little undulation of the data over the last couple of 3 weeks, but finally looks like the trend may start to break. But again, this is retrospective what has happened so far. What has just now happened in the community is schools are open. So keeping my fingers crossed that this will continue to trend down. But as a lot of kids mix and mingle and nobody's wearing masks, the chances are that this may turn around. It may just continue to burn out and go down. It's kind of hard to predict. But the conditions are not conducive for things to be going down. The conditions are actually the other way. More disease outbreaks to occur as we don't have public health tools in place. So what should we do? Again, I sound like a broken record, but get vaccinated, folks, for things that we have vaccines for. Otherwise, wear a mask and avoid unnecessary large crowds. And I've already covered the update on the third booster dose. Again, for immune-compromised, examples are transplant recipients, HIV patients, cancer patients on chemotherapy, or other immune-compromising conditions, like some medications like rheumatic or rheumatoid arthritis medications and some biologics can lower your immunity. So talk to your physician. That's the message. Don't just rush out to a pharmacy to get your third dose. Go talk to your physician and then get advice if you're appropriate candidate for this third dose. And then, yes, let's get you vaccinated. It is approved for the mRNA vaccines, the Pfizer and the Moderna. Currently, there's no need, or at least the data is not out there, to boost those who received the J&J vaccine. So they're on hold for now. But the folks that got mRNA vaccines, third booster is approved for immune-compromised folks. Vaccine data update. Numbers keep improving in Tarrant County, so that's great news. We have now 2.1 million doses given out. And for fully vaccinated folks that are the entire denominator of the county, 40%, and then those that are currently eligible, 12 and older, is 50%. And similarly, I have charts that shows race, ethnicity breakdown and age group breakdown. Again, the trend still remains that the younger age groups are less vaccinated. And I can't belabor the fact some of these folks don't have decision-making in their own hands. Their parents have to decide. One group would be 12 to 15-year-olds. Only 24% are fully vaccinated. I think the one-dose folks are about 30% range. School starting folks, and these kids are going to school. So if you haven't yet decided to get them vaccinated, now would be the time so that their immunity can help them fight off COVID in a school setting. Quick back-to-school update. Our clinics are still going strong. We get a lot of traffic at our Ridgemar Mall location. That's been the main back-to-school effort. And I kind of failed to point out something over the last few weeks. It's not a public health only effort. It's actually sponsored and put together by the Immunization Collaboration of Tarrant County. And one of their messages that has been their motto, I think it would be a good advice for our community: be wise, immunize. And that's not just a saying. I mean, it's really 100 years of wisdom into that one sentence. If you have the vaccination available, let's just get vaccinated, because we've been able to lower the disease burden in our community, eliminate some diseases, and vaccines were the reason why we were able to do it. So again, I wanted to give credit to these partners that have come together to host that back-to-school event for us, and they do it every year with us. And then, of course, other clinics and pop-ups that are still ongoing throughout the community. Here's our pop-up schedule. Even though we have pop-ups everywhere, and if people come to us for their third booster dose, we'll take them wherever we have a clinic. We're starting to add some capacity in anticipation that there will be a little bit of bump in volume. So, for example, our LeGrand Plaza location was running a half-a-day clinic because the volume was low. Starting next Monday, we're going to go 10 to 6, make it a full day, see if more people come and try to get vaccinated. Similarly, we had wrapped up our efforts in Hearst, but we've had a conversation with their fire chief again, and at the fire department on Precinct Line Road, we're going to reopen a clinic that runs Tuesdays from 10 to 6. In addition to all the other pop-ups and other locations that we're doing, COVID vaccines available everywhere, and we're not the only provider that does this. There's pharmacies, doctors' offices have it, and if somebody needs it, DSHS can easily provide. We're doing local transfers. So there's ample supply in the area, so it shouldn't be hard to find the vaccine. But we're still adding more capacity just in case there's a uptick in demand, and then we'll be ready to receive those folks.
If we could do something on our website
that
says here are places where you can go in the evenings, because a lot of people can't get there by 6 o'clock. And I know that there are pharmacies, but let's get something that says you can go to CVS, or you can go to Walmart, or you can go to Tom Thumb, or whatever. Let's list those places who are open,
yes, sir,
and are willing to give shots subsequent to 6 o'clock, and if we're not going to extend the hours of our particular ones. But
yes, sir. We will call these folks and find out what their hours are, and we'll try to post them. But I do want to point out that we extended the hours at Sundance Square, so they're now open on Fridays 11 to 8. And the numbers from 6 to 8 are very low. I think we had 8 people, but we'll keep advertising, and hopefully more traffic builds up.
Yes, and again, doing it at Sundance is one thing, but
yes,
the same people who don't have transportation available are not going to make it down to Sundance.
Understood.
So we need LeGrand Plaza.
Yes.
Might be a great place to do it. There are places in where it will be easier for people to get to and not have to pay for parking once they get there.
Absolutely. So we'll keep working on that and refine that and advertise more hours that are available, and whether it's by us or a partner entity or pharmacies, we'll try to gather that information and get it updated and pushed out on our social media as well. Quick update on mobile testing. So we were not expecting, but that's taken off. Unfortunate to say, the demand is pretty high. So I had to call in reinforcements. There's only so many people in public health that I can spend multiple different ways. So I actually asked help from our partners at City of Fort Worth. And if you all recall, last week there was a clinic that was done at the Diamond Hill location to gather some samples. A record day. In a short span of time, they got 220 samples out that day. Unfortunately, the positivity rate was almost 20%. So after that experience, we worked with Fort Worth, and they've come up with a mobile testing circuit of their own, just like they did last year. So it adds capacity to what we're doing. We have 6 locations covered, Currently, they have 8 locations that they're going to be covering. And in the community, we'll have plenty of testing choices. It's not limited to City of Fort Worth people in any of these locations. So anybody within the county can go, no problem. And then, of course, we're still working on other plans to see if the need is there. We'll continue to expand testing capacity. But so far, it's starting Tuesday for the City of Fort Worth, and ours has been ongoing. This is, I think, week 3. And then I have quick numbers to show you how fast the need is escalating. First day, we started with 5 samples. And then it quickly grew. That week, most places ended up at 60 or 70 samples. Next week, 90s were common, and this week is starting. Yesterday, we were at the Northeast Sub-Courthouse, 173 samples in a matter of 4 hours. So the word's getting out, and the demand is there. So we're going to continue to work on expanding that capacity all across to make sure people have ample testing choices.
There's also the ones that you can do the self or home tests. Maybe we don't have to give them to people just to do it at home, but it's my understanding, in fact, UNT had talked with us about this. I think they've also talked with the City of Fort Worth. You can buy these kits for somewhere between 10 and 15. They have 2 tests in them.
Yes, sir.
If we were to buy those to give to schools or to other places that are, very interested in testing, I think we ought to look at the possibility of doing that. And if not, making them available for people to take home with them. I understand you and I talked, but while if they take the test before they're exhibiting the symptoms, it's not likely that it's going to come back positive. But if they do have the symptoms, it's my understanding that the test is about 85% successful.
Yes, sir.
So, I'd like for us to explore the possibility of, purchasing a bunch of those tests and either asking our other groups, maybe UNT or whatever, to help us with the distribution and publicity or media surrounding those things.
Yes, sir. And in the meanwhile, you pointed out something very simple. These are available at retail. Kroger, Walmart, CVS, all these locations have them off the shelf, no prescription needed. They're usually $15, $20, and it's a 2-pack. And a lot of them actually have the ability for you to Zoom with a provider from the company, so you can do the test correctly, so they can observe you doing the test. So those options are there, and it's a 15-minute at-home test result kit. Again, if you're symptomatic, that's the best time to use these so that you know whether you have COVID or not. If you're not symptomatic, the results are not reliable, so we advise not to do that. Don't waste your money or time.
I agree with that, but again, that's $10 or $15 out of someone's pocket as opposed to us paying for it, especially if we can then turn around and give them to school nurses or to different events that might be wanting to screen people before if they notice symptoms or they have that. So if y'all can look at that and then maybe get back with us next week.
Yes, sir, we'll do.
Sort of an update.
And just so that you remember, this was the one that came from the state last year to all the schools. I checked with a few of them. They still have them, and they have current dates. So they plan to use them. And I haven't asked if they are asking for more from the state. I would assume that they are if testing need is there. But I'll gather all that information, and we can have a discussion on how to move forward. Yes, sir.
Yeah, and I would add to that is just a better timeline of our work to increase the testing capacity, and then also a recommended list for people who would like to avoid paying out of pocket for a test. Where can they go?
So, technically anywhere, because that is what the government has mandated, that no out-of-pocket costs for any of these COVID-related matters, whether it's testing or vaccine. But again, I understand there's confusion in the community, and there have been some practices brought to light where early on in the pandemic, some of the testing providers were just collecting cash and saying, here's your receipt, go ahead and deal with your insurance company. CMS came out with a decree back in May that typically that's allowed in the medical world, but for COVID-related matters, that practice is not allowed. So most of the providers that I've spoken with, that is not the case anymore. Usually if you have insurance, they'll take it. If you don't have insurance, they'll build a COVID provider relief fund. So whether you're insured or not, there's really no cost out of pocket because all the copays, deductibles, all of those things are prohibited under current federal guidance as long as there is a COVID emergency in place. So, But we'll be happy to continue to expand capacity. If the impression is that governmental testing's free, hey, we'll be happy to serve the public. So, and we'll bring some more materials to you over the next couple of weeks to look at on how to expand that capacity, and then we'll go as you all direct. So that's all I have. If there's any other questions, I'll be happy to answer.
I would just add that, again, we've been working with Bill and Regina, as well as Brian over Public Health, Catholic Charities. There's about 7 different events that they've got either on the books or have just recently held. It's best if we can give Public Health 2 weeks notice, but they have been great about showing up and when an event occurs and getting shots in the arms. And so I again want to thank you for doing that and getting that taken care of.
Absolutely. And again, thanks to all of y'all's team, because they're the ones who hear from the public and get us involved very quickly. And so we appreciate that partnership, because again, if we're doing the work, somebody else got to be listening to where the need is. So thank you for that. Yeah.
Thank you, Bernie.
All right. Thank you.
Before we go on with that, there's been an awful lot of back and forth information regarding the masks, regarding all of this. But we've heard, unless you've just kind of been in a shell and you hadn't watched any TV, then there's been constant back and forth between various government entities in the state. And Leslie, could you come up and just talk a little bit about where we are on this whole issue of masks and the back and forth between the governor and schools and counties? I guess Sharon's going to come up and talk about it. Or maybe both of them are going to come up and talk about it.
We're going to double check.
That'll work.
So regarding the mask, and we have advised you all based on our review of the law, as you know, under the Emergency Act, the county judge acts as an agent of the governor. That has been true since this all began and we all started dealing with the emergency situation of the pandemic. GA 38, which is one of the governor's latest orders, suspends the county judge's authority to act when it comes to mask mandates. And so our advice to you has been that the county does not have the authority to issue a mask mandate. As an agent of the governor, you can only do what the governor allows, and he specifically has not allowed that.
We talked, we had a meeting last week to discuss this, and then subsequent to that meeting, we talked with the cities and with the schools on a call, on a collective call. I think everyone, feels strongly that we wished we had more local control. But the governor has chosen not to give us that control. And when we talked with the cities, one of the concerns they expressed was that if we did something contrary to the governor, we were putting the police officers, the people that were out there and would have to enforce or whatever we did, in a position of who's right and making a decision. And the general consensus was we felt like, as Sharon just mentioned, that we're an agent and therefore we're bound by the orders that the governor has put out. Now, this was before the courts, there have been and will continue to be, I'm sure, temporary restraining orders issued. At least two, one in Dallas, one in, I believe, Bexar County, to stop the governor's order temporarily. One in Tarrant County to stop the school district's order to wear masks temporarily. Then the Supreme Court came into the deal and made a ruling which, I think supported the governor's position. Apparently Dallas believes there may have been some leeway in that, and so the bottom line is it's going back and forth. And at this point in time, at least from my perspective, and from, I believe, the majority of the folks within the cities, almost everybody in the cities, in fact, nobody necessarily likes it. We all very much and very strongly support local control, but we're we are where we are based upon what the governor has chosen to not allow us to do, and that's exercise any local control. So that's just kind of a back and forth. We're going to wait. We're going to see what happens at the next level, which is maybe the Supreme Court further refining the ruling that they came out with, I guess, Sunday, because that seems to be, Dallas is taking the position that they weren't clear enough and that their mandate may still be in place. I don't think the Supreme Court meant that to be the case.
So the ruling that the Supreme Court came out with on Sunday was actually, they just stayed the Court of Appeals order from having any effect. So they actually did not rule on the merits. They just said that the Court of Appeals, who upheld the trial court decision, that order was stayed. That in turn is why Dallas County is now looking to the trial court decision, which said that GA 38 certain sections are suspended. And so until the Supreme Court actually issues an opinion on the merits, then Dallas County and Bexar County are relying on their trial court orders to be able to continue to mandate the masks.
Okay, that explains it.
Well, and also, I just wanted to be clear that when we're referencing the we, that does not speak for me or for the constituents in Precinct 2 that I've heard from that want for us to do more. So
I'm sorry, go ahead.
Yeah, so I appreciate you all for explaining where things are right now, but from the constituents that I'm hearing from parents and from others, that want for the school districts to act and also want for the county to act to do more. So I just want to make that clear that it's not a unanimous decision to not move forward. I would like for us to do more.
Well, and again, the we I'm talking about is myself and the various conversations that we had with the cities and schools.
Sure.
And while a number, I won't say a number, a couple of the schools have expressed a desire to do more, or to basically go against the governor's orders. The rest have not. And from the standpoint of the order itself, that is my decision. And after council, after those discussions, I'm going to follow what I think to be the law and the oath that I took to adhere to that law. And so that's where we are right now, not because I like where we are right now. I would love for it to be a local decision, but the governor has chosen not to give us that option. And so I'm not going to go against what I've been advised is the law, and the advice that I've gotten, I understand and I agree with. So that's where we are.
Judge, I appreciate your position, but at the same time, people are looking to government to do what is outlined in the documents that created this country in the first place. And one of those things is to promote the general welfare. You can't promote the general welfare by sitting back and doing nothing in the face of a disease that is rampaging across the country and rampaging especially across the state of Texas. I know what the governor's order states. The consequences of the governor's order are on the governor's head as this disease continues unabated to rampage through our community. I support the actions of the various school districts that have voted to defy the governor's order. I take notice of the fact that the court that struck down the Fort Worth ISD's mandate did so based upon the procedure of how it was adopted, not on the merits of the mandate itself. I came up in life through the civil rights era. Civil disobedience is a part of my DNA. And I would like to see us press the envelope as far as we can while still protecting you. I don't want to see you go to jail necessarily. But we do have an obligation to protect the public, regardless of what the governor thinks.
And I, again, as I've said before, I strongly recommend, but I believe that civil disobedience is one thing, but breaking the law, and we are a country of laws, and we all took an oath that said we were going to obey the laws of the state and of the United States. So while I don't agree with this, the whole supposition that personal responsibility, because if that were the case, then why do we have traffic laws? We just get out there and drive however we want to drive because it's a personal responsibility. But this is what the governor has chosen at this time, and while I wish it was different, then currently it's not. And I just feel, from my perspective, I will not issue an order that I think to be contrary to the law that the governor has currently issued.
I support that. I do not support breaking the law. I don't necessarily agree with everything the governor's done, and I think local control is the key to letting our communities make decisions and are giving us the ability to make those decisions as one of the forms of government that's closest to the people. Is the best government that you can have. So I think he's put himself in a very small little box. It's probably getting smaller every day around him, but so far that's the law. And as I was on the call with the mayors Wednesday, and there was not one mayor on that call that supported breaking the law. And I agreed with that, and I said it at that time. So
I would just point out that an unjust law is no law at all.
We can agree to disagree on that. With that, we do have some audience participation regarding the mask issue, and so I'm going to go ahead and call on these folks at this time. First is Brody Mulligan. Brody, are you here with us? It was my understanding that Brody was here. Maybe he's had to leave. Is there anyone? There's not anyone back in the back rooms, are there? Okay. Next is Lydia Meeks. Please come forward. If you wouldn't mind, please go ahead and state your name and your address, and then you'll have 3 minutes to make any comments you wish to make.
Okay, my name is Lydia Meeks. I live in Hearst, Texas.
if you would like to take the mask off while you're speaking.
No, thank you.
Okay, well, I
Can you hear
thought
me
that might
clearly?
be the case, but I wanted to be sure.
Can you hear me clearly?
It's difficult, but
Maybe just move a little bit closer to the mic.
Well, okay, I think it's 15 minutes, right? You
Or-
have 15 minutes before you
Or
get...
you can take the mic out of the
No, 15 minutes before I could catch COVID. Okay, hello. My name is Lydia Meeks. I'm a resident of Hearst, Texas. Last night, I attended the HEB ISD school meeting, and it was devastating and disappointing. I was shocked to see that no one from the local health department was there. They were presented with outdated numbers, and they were comparing data from last year to this year, not even taking in consideration from the different variables, and not even taking consideration about the new variant. And that is the story of so many districts here in Tarrant County. Parents and loved ones are all devastated, having to choose between an education or keeping your child safe. I am an aunt of 2 girls in the HEB district, 2 girls who are not eligible to get a vaccine yet because 12 and under cannot. My niece is a high risk. She was born at 23 weeks. She survived. She's now 7 years old. My other niece lives with my 2 parents who are also a high risk. My whole family is a high risk for COVID. If one of us got COVID, it would be devastating to our family. And yet, when we go to these schools, the majority of people are not wearing masks. They're not even encouraging people to wear masks. The numbers do not lie. Research has shown that the Delta variant has up to 1,000 times higher viral load than other variants and has a rate of transmission of 6 to 9. This means that one kid, one teacher, one bus driver, one person can affect 6 to 9 people. As of today, Texas is the leading state with 509 kids hospitalized for COVID. How many children will never recover from this? These numbers will continue to rise if we do not do something. And these next few months will be crucial, and our response to it will be crucial. These districts have taken away our options. It's either you show up to school or you unenroll. There are no options to keep our kids safe from this deadly virus. I am asking that you protect these districts by issuing a county mask mandate. And I'm asking you to do what countless other counties have done for their people. You need to do more to protect us. I have also created a petition to make masks mandated in Tarrant County. It now has over 400 signatures, and that's only in 2 days, and it will continue to do it. I also created one for HEB ISD, and now that one has over 800 signatures. I'm asking you to protect the children and teachers in your county. They can't teach children if they are all sick from COVID. Thank you.
Lydia, thank you very much for your comments. Again, is Brody Mulligan in the audience?
There's nobody in the back room today.
Thank you very much. Okay, I've got 2 phone. The first is Audrey Gow.
This is Audrey, and I apparently missed your call, but I will get right back to you. Please leave a message at the beep. Thank you.
Audrey, this is Judge Whitley, and I'll be calling you back in just a few minutes in case you get this. Again, it's to give you an opportunity to participate in our audience participation time on our agenda. Again, Judge Whitley, and I will be calling you back in probably about 2 or 3 minutes. Next is Courtney White. Courtney,
Yes.
this is Judge Whitley, and we are at the point on our agenda for audience participations, and you had indicated that you wish to address the court on the matter of masks. If you would, please just state your name, address, and you'll have 3 minutes to make whatever comments you wish to make.
Okay, thank you. My name is Courtney Waite. I live at 1509 South Lake Street, and I just have a short comment. I'd like you to please put a mask mandate in place for all public spaces and businesses. We need to do everything in our power to keep Tarrant County residents safe. Thank you.
Thank you. Have a good day.
Thank you so much. Okay, you too. Goodbye.
Goodbye. Okay, we'll try Audrey again.
This is Audrey, and I apparently...
Okay, that is everyone who wished to participate, make an audience participation. So we will move on with the agenda. Lisa?
Judge Commissioners, under item number 1 concerning activities associated with the impact of coronavirus, I simply want to note that you have a report that we have provided on our COVID-19 recovery efforts. As Mr. Maney noted last week, we have made changes to this report and will be showing the programs that are currently in process and be adding different programs as we implement more under our FRF. So if you have any questions on that, just let us know. And the next item we'll move to concerns engagement of a firm to assist with redistricting, and I'm going to have Chandler Merritt come forward to present that item.
Still good morning. Good morning.
Good morning.
Commissioners, for your consideration this morning, we have an engagement agreement with, Bickerstaff, Heath, Delgado, and Acosta to provide redistricting services for Tarrant County. If there are any generalized questions, I'd be more than happy to answer them. If you have more specific questions, we do have a representative from Bickerstaff, Mr. Bob Heath, who can take more detailed questions if you have them.
Your Honor, I have spoken with Mr. Heath this morning, and we know each other well, having worked together on redistricting for a number of redistricting cycles going back to 1991. I am not ready to vote on this issue today. I would ask that the court extend me the courtesy of not considering this for another week.
So you're ready to put it on the agenda next week?
Yes.
Okay, do you have any questions of Mr. Heath today?
No, I don't.
I don't have a problem with holding it for 1 week. Does anybody have any questions? I would at least, Mr. Heath, come on forward if you don't mind, because I'd like to ask just a couple of questions. Looks like your knees are working about like mine are.
That's right.
My questions, I guess, y'all have gotten some preliminary information now.
Well, the legacy data was released Wednesday, but it has to be processed, which will take probably a couple of weeks or so to get it done. So we don't have data that's usable, but it's out there.
Okay.
And will be available around the 1st of September or so.
So it sounds like from that standpoint, a week is not going to make any difference from there. And we certainly don't want you to expect
Sure.
or have to come back up here. So
We can work with that. Obviously, the sooner you get people engaged, the better, because counties are in a tight time frame, but we can certainly deal with a week.
And so I noticed that in there, it talks about not only our commissioner precincts, but also JPs and constables.
Correct.
In the past, as I recall, we have not done JPs and constables at the same time that we did the commissioner's precinct. We waited until a couple of years later, and I thought, or I recalled, doing that at a different time.
I'll tell you, I don't remember on Tarrant County what we did, last time, but as far as JPs and constables. But it is okay to do that because they are not covered by one person, one vote. So legally, you're putting yourself in jeopardy if you don't do commissioners, because you'd be liable to a one person, one vote suit once people have the data. But that concept doesn't apply to justice precincts. So you could wait for those.
Those are made more based upon the volume of the different courts, JP courts, and our services?
Right. Well, actually, the Constitution says that they are redrawn for the convenience of the people. And so you can sort of do whatever you want, but I think caseload is obviously a big consideration.
Caseload is the way we've approached it
Right.
in the past.
And I've had a couple of JPs mention to me that, they could see a reshuffling of some of the volume in some of the areas, truancy, some of those types of things that have been the case.
Judge, I do recall that we did JPs and constables because we had a night meeting 10 years ago. And there's a certain reason why I remember that meeting, but a gentleman that was here ran against me. So anyway, we did have a meeting here. We did discuss them, and we did set those boundaries.
Yeah.
We did the commissioner's boundaries first.
Yeah.
But then we did those same.
Okay.
There have been some cycles where we
Yeah.
didn't do JPs and constables at all.
Yeah.
We probably did 10 years ago, I don't recall. But there have been some cycles where we didn't do it at all.
Right. And it might make sense to delay it simply because you're going to be in a tight time frame this year because of the delay of the census. So if you can put those off, it certainly doesn't hurt to do it.
Your Honor, we did contract 10 years ago to do the JP and constables at the same time that we did contract for the redistricting of the commissioners' precincts, but we could always contract now and have them do that work afterward. I do know that throughout the years, then there has been some shifting of those constables and JP precincts according to volume within that 10-year period also.
And they helped us, I believe, with that shifting.
Well, I see this. I was obviously involved 10 years ago, and Commissioner Brooks, you said you were here in the early 90s and with your commissioner at that time. Right. And so you would have been very much involved.
But I did the grunt work.
Yeah, I understand. But I see this as a court, basically a team effort, that we all work together and you get 4 precincts that win.
Yeah.
Okay? This is not to hurt, but everybody wins.
Right.
We balance our population or come close to balancing it within certain guidelines. Is that correct?
Right. Typically what we suggest people do is to begin by adopting a set of guidelines, which will be things like districts are going to be compact and contiguous. They're not going to split communities of interest to the extent possible, and things like that. Mm-hmm. And that sort of helps set a framework for doing it. But then the main things are we're going to have districts that are relatively equal in population and comply with the Voting Rights Act. You know, those are the main things, because that's where obviously you need to comply with those legal requirements, and you subject yourself to legal liability if you don't.
Okay. Any other questions? JD, Devin, any other questions at this time?
No, I'm fine with Elaine. Oh. I'm not sure what he said.
Okay, so we will, please don't feel like you need to come back next week.
All right.
Hopefully everybody's gotten their questions answered from that standpoint, but we'll delay this for 1 week. If you put it back on the agenda for the 24th, then we'll.
And if anybody has a question in the meantime, if they want to call me individually, I'm certainly available.
I might dial you in if there is any kind of a questions next week.
Okay.
Feel free not to. Please don't come back up here.
Thank you very much.
Thank
And it's good to be before the Tarrant County Commissioners Court again.
Thank you. Okay. Okay, so it looks like Renee's next.
We have one item we're asking the court to consider this morning, and that is to receive and file the Tarrant County financial statements for the month ended and period ended June 20th, 21.
Move for approval?
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Move to receive and file the personnel agenda.
Second?
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good morning and thank you. We have several more items for the court this morning. The next item, item 2, is requesting approval of an extension of project employment for the county clerk's office. Ms. Nicholson is requesting a 1-year extension of a project employee who signed to their imaging project. There is no impact to the general fund.
Move approval.
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Next item, we're asking the court to approve an out-of-class pay extension for the ME's office. As explained in your court communique, we're requesting this extension through the end of August this month, so it's only 7 days. This individual assumed the duties of the IT chief who retired, and we're looking at a cost of $179, so less than $200 to the general fund.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Next item, we're asking the court to approve an out-of-class pay extension, another one. This time for Precinct 1, Commissioner Brooks is requesting an extension through November the 22nd. He has an individual who assumed the duties of Mr. Tabor, who retired. This is Doug Kelly, who assumed duties. There is a cost to the Road and Bridge Fund of approximately $1,396 and some change.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
For the next 2 items, I'm going to ask Amber Duckworth, our benefits manager, to step forward and make those presentations. And while she's stepping to the podium, I do want to remind everybody, I guess remind is the right word. Please check your emails. Everybody should have an email from Henry Tolstead. Henry is our wellness coordinator. He's our new coordinator. And he sent out some information about upcoming biometric screenings. And what's important to note, in addition to the biometric screenings, is that at some of the events we've partnered with public health and we'll be offering the COVID vaccination. And so that would be an opportunity then for individuals who are coming out for the screenings to also get their vaccines if they don't have them already. So that's not at every location, so you'll need to pay close attention to the email and those specific locations where public health staff is available to come out and give vaccines. They'll be given vaccines. And again, it's Henry Tolstead.
Tina,
Yes, sir.
have we incorporated PSA screening into the biometrics?
That is being worked on. Do we have a schedule yet for that? Okay. That is being worked on. I do know that. I think Robin will be en route shortly, and maybe she can address that when she's here, if she's not here already. Oh, she's here.
Robin
Hi, Robin.
snuck in. She wasn't here for her employee recognition. but
She was
sneak in.
hiding.
We'll catch her next week. Don't worry about it.
Trying to avoid y'all. No. Yes, we are working on the PSAs. We've had some challenges getting a new agreement, but we have received one just yesterday, and hopefully we'll have that on the agenda for y'all to approve that. Tomorrow, they are separate events, and they'll be in September.
Thank you, Robin. September is Prostate Cancer Awareness Month, so that is perhaps appropriate.
Good morning for 2 more minutes.
How are you?
Doing well, thank you guys.
Good.
So joining me this morning is our dedicated nationwide retirement specialist, Mr. William Angus. He is here. He's going to present to us, but before he comes up, I'm going to kind of summarize what we are asking for your consideration and approval of the Nationwide's retirement plan fixed indexed annuity and a reduction in pricing fees effective today, August 17th. If you'll recall, Tarrant County offers deferred compensation programs, which is a voluntary tax-deferred savings program established to assist employees in reaching their financial goals in retirement. Participants enjoy the convenience of automatic savings through payroll deductions, realizing a tax deferral each pay period, and accumulating tax-deferred growth on deposits. Tarrant County has authorized 3 companies to manage deferred compensation for us, and they are Nationwide Retirement Solutions, Lincoln Financial Group, and AIG Retirement Services. And I'm going to go ahead and turn it over to Mr. Angus.
Welcome.
This mask here. Thank you very much. Thank you for having me here. Again, my name is Will Angus. I am your nationwide representative here. So just a little background from me. I am new to your group here within about, 4 or 5 months. I have been with Nationwide for over 5 years, but I've been in this industry for over 25 years in the financial services industry. I am a resident of Tarrant County, born and raised here on the east side of Fort Worth. Very proud to be able to work with your group here with Tarrant County. I have been working on the dark side over in Dallas County for a while, but I live in Haslett, so they have graciously moved me over here to this area, and again, I look forward to working with you. Hopefully you've been able to look at the 2 things that we're wanting to add to the program. The first one, in regard to the price reduction, we really appreciate the relationship we have with Tarrant County and us being able to help your employees get ready for retirement. And this is just an olive branch here to you guys to reduce those fees, 25 basis points for the mutual funds. This is something that we do as the assets get higher in the plan. And right now the assets are somewhere north of 90 million in the plan with Nationwide. We are going to be looking to actually even do an additional price reduction probably early next year as you guys get close to 100 million in the plan. So we're really looking forward to growing this plan, and this is a big thing to be able to reduce these fees to the participants. So that really, again, is, all you guys have to do is say yes, and we'll do that today. The other product that we are going to offer on the plan, again, pending your acceptance of it, is called the IPP Income Principal Protection. So we've had a fixed account in this plan since when we started the plan. It is right now, I believe, somewhere in the lower threes, 3.25, something like that. It is a fixed account, just like a savings account. So you put that money in, you're going to get that interest rate. Now, about 1.5 years, 2 years ago, we came to the county and said that this interest rate will be fluctuating, okay, according to how the interest rates of the Fed, things like that are happening. So this interest rate has been fluctuating a little bit, has been going down a little bit, okay? So this new product that we have is tied to the S&P 500, okay? It has no downside. You have no risk to principal in this plan. So let's say you have money in this plan and the S&P 500 goes down actually for the year. You do not lose money. You would stay status quo. But as the market has been going up, we actually have a ceiling on this plan of 9.5%. So if the market S&P 500 goes up 7%, then your account would go up 7%. If the S&P goes up 10%, since the ceiling is 9.5%, you would actually get 9.5%. So this product is basically for somebody that is conservative but wants to try to take advantage of the market upside with no downside risk, okay? This is something that the county does not have to, there's no extra charge or anything like that. There are no annuity costs to this, even though this is kind of considered an annuity. There are no extra costs to this fund. So again, really for somebody, let's say somebody has a pretty good amount going into retirement, they've invested in the market in the past, but they are worried about how the market is going to perform in the future, but they still want to take advantage of that if we do have an upside for the S&P 500. They can put this in here and not have to worry about losing money, but can actually take a little bit of risk to try to gain some money, okay? It is an option. Again, they can put as little money or a lot or all of their money into this fund, just like all the other mutual funds that are available within the plan. You don't have to put everything in there by any means. So, but again, just to give your participants another option to be able to invest in the 457B plan. So those are our two things to request for the commissioners and the judge. And again, we do appreciate the opportunity to work with participants, and hopefully I'll get to know and get to meet with all of you individually, and would love to be able to chat as well. So,
questions?
Move approval of Nationwide's plan changes.
Second. The one question I have is, you said that it goes up, you can never lose principal?
Correct.
Is the principal always the prior year ending balance?
So it is a 1 year, basically when you put money in the assets, it is a 1 year commitment, okay? So each quarter has a ceiling to it. So far, every quarter that we've had, this is probably
so
about a
2.25% ceiling per quarter.
9.5 is what that is. It's 9.5 per quarter for that. That's the ceiling.
Let me give you an example.
Okay, sure.
I put 100,000 in.
Mm-hmm.
First quarter it goes up 9.5%, so now I have 109,000.
Okay, now like I say, it's a 1 year commitment.
Well, that's what I
so
asked.
at the end of the year, yes, sir. Yeah.
So it could only go up 2.25%, or we'd go all the way to the end of the year.
Exactly. Yes.
So now it's been a great year. Mm-hmm. I started off with 100. I get to the end of the year, 109 is as high as it can go.
Correct.
So the next year comes along.
You'll have another.
Is the floor 109?
So each quarter it is reevaluated. So this is kind of, they're doing futures for the S&P 500. So it is evaluated every quarter. So far, every quarter has been 9.5. But there could be quarters where that ceiling could be lower. And you have the choice every quarter to be able to keep putting money into this or not, okay? So
I'm going to ask the question again.
yeah.
These people are used to it.
No, that's fine.
I get to the end, we start off in 2022, I put 100,000 in there. At the end of the year, that's now at 109,000.
Correct.
So now we're starting forward with 23.
Correct.
Is my floor 109?
Oh, okay. So you can reinvest the whole 109, or you could reinvest 50,000 of that.
Start over.
You basically start over.
At what point in time do I begin taking the annuity, and then do I still have the ability to take money out?
So again, once that year, every deposit has a year. Okay.
That's the new floor.
So once you get to that year, you can either reinvest, or you can take that money out and put it into something else. Okay. There is, again, when you say annuity.
So it's an index on the Standard & Poor's.
Correct. And your access to this money is, there is no restriction to the access. That's what's different between this and a normal annuity. A normal annuity would say, hey, we're going to pay you a monthly check whenever you annuitize. This fund is completely accessible whenever you need it. Again, but once you put money in for one quarter, it has to stay in there for the year to get the percentage from those 4 quarters. Okay, so you're having to say, you're thinking about every contribution that you put in, there's a year commitment. So you can actually stagger things as well here. So if you put money in this quarter and then you put money in next quarter, it starts a new year. Yeah, every quarter, yes.
And the amount that I take out can be anything I want to take out. Or if I said, okay, I want you to do it like a separate, like an annuity, and say, okay, I want you to take this amount and start paying me an annuity based upon my life expectancy.
No, we can do that, but
But at each quarter, I could make the decision to say, King's X,
right.
I no longer want to do it as an annuity, I just want to take all my money out.
Correct. But again, you have the year commitment. Okay, so if you put your money in there for 6 months and you decide to take that money out, then yeah. And your money is in basically a holding tank that is getting a little bit of interest, not very much, somewhere around 1%. So that's kind of that holding tank. So if you're putting money in now, at the beginning of the quarter here, it invests into that IPP, and you need to leave it in for a year, okay?
And you said the ceiling is 9%.
9.5 actually right now, yes.
So if it goes up by 15, you win. If it goes up by anything, if it goes down below 0.
Right, that's the risk that we're taking with this, yes.
And if it goes up 1%, I get 1%.
You get 1%.
Nobody wins.
Correct, yes. That is correct.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Well, nice to meet you.
All right. Thank you, folks. Thank you very much, and I look forward again to working with all of you. Please reach out to me and set up a meeting, and we'd love to be able to come by. And thank you. Thank you very much.
Just think, Amber, that could have been you.
Be nice. Okay, next up, we are seeking approval for our 2022 plan choices, service providers, and the contribution rates for the 2022 health care benefits for Tarrant County active employees and retirees. This information presented has been recommended by the PBC Board of Governance and Tarrant County Benefit Committee. There are 2 new vendors for for plan year 2022, which I'll go over in a few minutes. And I would like to go through each exhibit and request court approval for each independently, if that's okay. So first, we'll look at Exhibit A, which outlines the PBC plan changes. The PBC board did approve the plan design changes for both the high deductible and PPO medical plans to cover applied behavior analysis, or ABA therapy. That's for autism spectrum disorder. ABA therapy is a well-documented and effective treatment for children who receive early intensive treatment with positive outcomes. Also, we have the addition of treatment that comes with clinical management through our Behavioral Health Solutions program with Optum. So with the BHS, we'll have prior authorization required before scheduled admission for mental health services, or as soon as possible for non-scheduled admissions or for emergency admissions. The Behavioral Health Solutions program requires prior authorization for intensive outpatient treatment programs, for partial hospitalization programs, psychological testing, extended outpatient treatment visits beyond 45 to 50 minutes in duration, office-based opioid treatment, outpatient electroconvulsive treatment, transcranial magnetic stimulation, any home-based outpatient treatment, and intensive behavioral therapy, including the ABA therapy. Any questions before I jump to the next items? Okay, so for plan year 2022, I mentioned we have 2 new providers. So we are switching from Cigna Dental back to Delta Dental for both the PPO dental plan and the HMO dental plan. The PPO dental plan is self-funded, and if you'll recall, the employees' contributions pay for those plans. The plan design remains the same for both the dental PPO and HMO plans. The HMO plan is fully insured, and I'll go over those premiums that have been provided to us by Delta Dental in the last exhibit, Exhibit D. As a reminder, on the dental HMO plan, it does require you to see an in-network dentist in order to have the dental coverage. And then we've also changed for our vision plan from IMED to VSP for 2022. The vision plan is fully insured as well. It provides enrollees with in and out of network benefits for eye exams and materials, including prescription lenses, frames, and contacts. And then next we'll go over the account limits on your health savings account and flexible spending accounts per the IRS. There is an increase to the allowable annual health savings contributions in 2022 for both the employee and employer contributions. So those enrolled in the high deductible plan as employee-only coverage can contribute up to $36.50 in their health savings account. That is a $50 increase from this year. The employee and employer contributions added together cannot exceed that annual max. And then for the family coverage or for the health savings account, if you are enrolled with employee plus spouse, plus children, or plus family, you may contribute up to $7,300 into your health savings account. That's a $100 increase from this year. And continuing with the age 55 or better, you may continue to contribute an additional $1,000 as a catch-up in 2022. Your flexible spending maximum contributions remains at $2,750 for 2022. That does not include the employer contributions. So those continued flexible spending account contributions that Tarrant County generously provides does not count towards that $2,750, which is nice, and that does apply to both the limited purpose and the general purpose flexible spending accounts. And then lastly, for our retirees, we have a Renew Active by United Healthcare, which replaces Silver Sneakers, which a lot of people are familiar with the Silver Sneakers fitness program. So beginning in January of 2022, this enhanced fitness benefit is available to all retirees enrolled in one of the Medicare Advantage plans. And if you'll recall, we offer 2 Medicare Advantage plans. One is a PPO and one is an HMO. And I'll go over those a little bit later. So this program encourages physical wellness by offering a free gym membership to a nationwide network of gyms and fitness locations, access to the largest nationwide network among all Medicare fitness programs in the country, with local and national options, including the YMCA, LA Fitness, 24-Hour Fitness, Anytime Fitness, Snap Fitness, just to name a few. Additionally, there are thousands of workout videos through Fitbit Premium, which does not require a Fitbit device, but this program does allow alternatives to our retirees that are unable to go to a gym and still get fit at home. So with that, I'll ask for approval or questions for Exhibit A.
Second. We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes 4-0. Just indicate or show that Commissioner Allen is not present for that.
I'm back.
Commissioner Allen is present for that vote, and it is unanimous.
Thank you.
Thank you. Okay, Exhibit B. This is a list of our 2022 service providers with their premiums and fees. All changes are highlighted in yellow, and I'll go through each one very quickly. So number 1 is the dental HMO. We have a change, of course, from Cigna DHMO to Delta Dental HMO with a reduction in monthly premiums. And again, that's fully insured, and those are premiums delivered by Delta. And number 2 is the Delta Dental PPO plan self-funded administration fee. There is an increase for 2022. Number 3 is our change to vision providers, which is VSP, and there's also a decrease in those monthly premiums. Number 4, we have an increase of 72 cents to our United Healthcare Medical Plans administration fee, and that is due to the addition of the ABA therapy and the behavioral health solutions that I mentioned earlier. Number 5 is no change to the fee for EAP, nor for wellness. Number 6, nor for number 7 for the HSA contribution to seed money. Number 8, we don't know currently what the rate will be for 2022, but we should know in October, so I'll be coming back with that rate on our stop loss with United Healthcare. They just want to see more claims data through the end of September before they come back with that rate. Number 9, there's no change to our pharmacy services admin fee. Number 10, no change to our long-term disability with standard. Number 11, no change to our group life insurance rates. Number 12, flexible spending credits, no change. Number 13, no change to the fees associated with flexible spending, COBRA, and retiree billing administration. Number 14, we do have reduction in the premiums on the Medicare Advantage HMO plan. So for 2022, we'll be going down from $232.46 to $220.84 for retiree-only coverage, for example. And then the $441.68 is the reduction for retiree and spouse, and that is for both the retiree and spouse covered by Medicare. Then secondly, we have the Medicare Advantage PPO plan that was also delivered to us. It's a fully insured product from United Healthcare with a reduction in the monthly cost. So for retiree only, it's going down from $474.74 a month to $451.01 a month. And then that doubled amount for retiree plus spouse. And then the senior supplement plan, that is a very small number of folks still in that plan. It has been offered to those only because they don't have the prescription drug benefit with that plan. And United Healthcare last year offered to keep those enrolled in that plan because you cannot have two prescription drug benefit plans at the same time. It would cause an issue. So that's status quo for the senior supplement plan. And then we're not recommending any rate increases to our non-Medicare eligible dependents that are covered with a retiree.
However, I'm going to make a suggestion a little bit later that might affect one individual, currently might affect one individual in that particular category, I believe. Am I right or am I wrong?
It'll affect...
Didn't we have one PSS in the PSS plan?
Yes.
That had a spouse. So I want to ask one other question before I make a motion to approve this.
Okay.
It may be subject to one change, but I want to go back for just a minute to number 2.
Okay.
Because it was my understanding that we were reducing the overall premiums on our dental because of the size of the reserve that we had. Remember, dental is a self-insured plan that is totally paid for by the employees and is in no way subsidized by the county.
You'll see that on Exhibit D.
So this is just what's costing the county. It's not, we have not got yet to what we're charging the employees.
Except that that's correct, except the DHMO were the delivered rates by Delta Dental. So number 1, those are the reduced premiums for, and that is what it is because it's fully insured. So instead of $12.57 on the DHMO, employees and retirees would pay $11.94.
So this is just, so on item 2, that's what the county is having to pay for
per
the
employee per month.
And then
correct.
when we get back to the rates on Exhibit D, that will be what impact we've passed along to the
Yes,
employee.
sir.
Okay, so with that, I will make the motion that we approve Exhibit B, and I'll give you a caveat that we may come back to one of those items in a moment.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, Exhibit C1. This is our active employee medical rates. The top chart is showing you current 2021 rates for the HDP with the health savings account rates on top, and then below that is the PPO medical rate. We are recommending no rate action for 2022 to keep the rates exactly the same, which you'll see in the bottom chart for 2022. The yellow box shows the differences between the rates. So you'll notice with identical plans, HDP to HDP, for example, there's no rate increase. But if you were to move between plans during annual enrollment, you could see a decrease or an increase depending on which way you go. And we are recommending the continued employer seed money of $750 for enrollees in the high deductible plan.
Move approval.
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, Exhibit C2, because we weren't recommending any increases or changes on the actives, we did the same for the under 65 retiree group. If you'll remember, this group is what we call our matrix group. So we do base the employer subsidy based on years of service. So at the very bottom of Exhibit C2, kind of the pink rows, you'll see 25 plus years of service on the left-hand side. And then you'll see our census in those tiers. For example, in the high deductible plan, you'll see 7 are enrolled as retiree only, and they're paying $291.47 a month, which is 20% of the total cost. And then if you go down to the PPO, you'll see we have 136 retirees enrolled as retiree only, and they're paying $275.23 a month to be enrolled in the PPO plan. And if you go up to the 20 to 24 years of service, you'll see there's still some concentrated census there, but it just kind of goes down as you go up because it's more expensive to the retiree. So this is our under 65 non-Medicare retirees that are on and offered the same plans as actives, so the PPO and high deductible plan.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Before we move to the next one, she's got that look because we've talked, so we're not surprising her. What I want you to do is I want you to turn back one page to page 7 and recognize that if we have an employee, that employee is going to pay $180 for just employee costs. And if it's employee and spouse, they're going to pay $512.
On the PPO.
On the PPO. And if you go to the next page, what we've just approved is that if that employee then decides to retire, they're going to pay $200, as long as they're not Medicare eligible, they're going to pay $275. And if it's employee and spouse, or retiree and spouse, they're going to pay $568. So that says that the spouse for this retiree has cost an additional $293, almost $300. And so you've got, they're an employee, they decide to retire, we're charging them about 20% more, 120% of what we were charging. We as a court have always said there's additional cost for that pool of retirees who are continuing on our plan as we're required by law to offer it. And for the most part, they cost us more, but as a court, we've decided we're going to charge them approximately 120%. So now they're retirees. They went from employee to retiree and retiree spouse, neither of which are Medicare eligible, and we're charging about 120% more. Now, start the next discussion.
Okay, so on Exhibit C3, if we'll start on the left-hand side, and you'll see the census. So we have 360 retirees enrolled as retiree only with Medicare. And if you keep going over to the right, so for 2021, they were charged $246.86 a month. For 2022, that rate has gone down $10.08. So as long as this Medicare eligible retiree has 10 or more years of service with Tarrant County, they're going to get that rate of $236.78. If they don't have 10, if they have less than 10 years, they would be still offered the retiree insurance, but they would pay the full amount, which is $451.01 a month. So we're still, this is Medicare, okay? In addition, they're going to be paying their Part B premium through Social Security, which averages $148.50 for Part B. If they have a Medicare eligible spouse, drop down one, there's 97 retirees that have the retiree plus spouse coverage, both Medicare. So for 2021, they pay $493.73 a month. It's going down $20.17. They're going to pay $473.56 a month. And then you can go down to the next middle section, and you'll see the same thing for the Medicare Advantage HMO plan. Skip down again, you'll see there's 1 and 1 for the PSS, that very small group of folks left in that plan. So I don't think there's any issues with those people, because those are the Medicare with their spouse is Medicare eligible. We've been delivered these rates from United Healthcare. They have the choice of the Medicare Advantage PPO, the Medicare Advantage HMO. If you drop down, if you're looking at the top chart again, so we're in the Medicare Advantage PPO plan, you'll see that 14 in the census column. So we have 14 folks that are enrolled with retiree plus a non-Medicare spouse, which means the spouse is going to stay on the PPO plan, same plan as actives. But the retiree has now moved to a Medicare Advantage PPO plan. We have carved out a rate to charge to allow that non-Medicare dependent to remain covered with this Medicare retiree. And there was some discussion about that rate.
Okay, so let me kind of try to take over from there. So I want you to put a line on, you see the 14 that she's talking about in that first band, put a line all the way across under that, then go down and you see also one that says for retiree plus non-Medicare family rate. And then go down to the next band and you see a 2 that says retiree and non-Medicare spouse, and then go down again to the one that says retiree, non-medical or non-Medicare family, and then go down to that last band that starts with PSS, and you see the 1 that says retiree and non-Medicare spouse. So here's kind of in looking at it, what I found and what I would like to, the end result is I'm going to ask you as a court to, instead of approving this today, and we've got to turn the premiums into PEBC by Friday. And so what I would like to ask you all to do is to give authority to the Benefits Committee to review this and to consider making changes. We might not make any, but we're going to consider, and here's why. So I retire, and my spouse and myself are both below Medicare. And we pay, at that point in time, the very top there, that's $236.78, and then retiree and spouse, no, that's not right.
No. You would
That's
pay
not right. Go back to the
560.
previous page.
Yeah.
And if you look down there, it's the $275, it'd be $568.84.
C2.
On C2. And so in that situation, if it was retiree only, I would pay $275, and if I have my spouse on there, I pay about $567, or it's about, they're charging about $200, we're charging about $293 for the spouse. So the next year, I become Medicare eligible. Spouse, still not Medicare eligible. My premium goes to $122.
If you pick the HMO, correct.
So I go to 122, but in addition to that, that's what I have to pay the county, but I also have to pay Part B Medicare, which is probably going to be
Call it 148.
a month, or $150 a month. So
Yes.
on an annual basis, that'll be another $1,800, something around that. And all of a sudden, my spouse, who last year cost me about $300, is now going to cost me $900. Nothing else has changed. I've gotten a year older. I'm now on Medicare. But all of a sudden, my spouse is going to cost $600 a month more. And so you take that $7,200 plus the $1,800, and an employee who turned 1 year older and now is Medicare eligible is going to be paying an extra $9,000. Plus, and then, but if I'm married an older spouse, and the older spouse becomes Medicare eligible, there's no change in my premium or anything else. So there's a discrepancy there that we might want to, and I talked with several people this morning, but I didn't bring everybody together and us have an opportunity to discuss and possibly change that.
I see your point, and I think it's a valid one. Have you got a motion that would reflect what you're asking?
The motion would be, and I'll make the motion, that we empower the Benefits Committee to meet, and between now and Friday, set a premium for this last page, and we've already done everything else, but for this last page, and again, we're talking about this next year, or this year, we would have been talking about 22 people. And so we're not talking about a huge number. Now, that doesn't mean the number won't change, but I would like for permission for this Benefits Committee to be able to actually set the premiums for this one category for this next year.
I will second the motion with a question. Who's on the Benefits Committee?
Everybody in the world. Commissioner Fickus, GK, Amber. Now, we get into departments. What I would say is that, because we're not giving everybody who shows up in the room a vote. It'd be Commissioner Fickus, myself, HR, audit, budget. Who have I left out? Now, we'll have 20, 25 people in the room, but it's those folks.
Okay. I'll second.
So we have a motion and a second. Now let me open it up for any questions.
So then after Friday, if we have to respond to PEDC by Friday, then does PEDC then still have to take subsequent action, or once
No.
we make, then that's it?
We set our rates.
Right.
So all they're going to do is take and print whatever we've told them to print, but it's the print deadline, not any deadline.
Other deadline.
Yeah. If there's no other discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Does that mean you're buying lunch for everybody?
Well, Amber would certainly be in favor of that.
Including Amber.
So we'll see we'll set the meeting, but it will obviously be, it may not be tomorrow, but it could be anywhere between tomorrow and Friday. But somewhere in there, we got to have a meeting.
Your Honor, we can bring that back next week to receive and file if there's any changes.
Okay. Well, okay,
Okay.
yeah.
Yeah, that'd be good.
And,
All
then-
right.
and the last one is Exhibit D for our dental and vision rates. And you'll see the top chart is for dental with the self-insured PPO dental plan on top. We have shown a reduction in monthly premiums to our employees and retirees. So $30 if you're enrolled as employee only, $55 a month, employee plus spouse, and so on. And the yellow column will show the decrease from current rates to the proposed rates for 2022. And then below that is the delivered rates that you've already approved for the dental HMO plan. And then also the vision is also a decrease there. So I'll ask for approval or questions on D.
Move for approval.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you very much.
Thank you very much, Amber. I don't see anybody standing up. Public Health, Vinny, come on down.
All right, so Public Health has two items for your consideration this afternoon. So item number one is a request for approval of the Centers for Disease Control Public Health Crisis Response Cooperative Agreement. That is the Public Health Workforce Contract with DSHS. I think we talked about it. We're going to be receiving about $1.5 million for COVID-19 response.
Move approval.
Second.
A motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously, and I think we've put item 2 on hold.
Correct. All right.
For 1 week.
Thank you.
Thank you. Melissa? Good afternoon.
Good afternoon. We have two items for your consideration. The first item is an award recommendation for bid number 2021-090 to the refurbishment of inmate property conveyor and property bag replacement for facilities management, awarding to Roberts Maintenance and Engineering in the amount of $428,093.46. If approved, we're also requesting contract approval and acceptance of the payment and performance bonds.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the second and last item is regarding bid number 2021-121. This is the Newt Patterson culvert replacement for transportation in Precinct 2. We're requesting a rejection of all bids and permission to rebid with revised specifications.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you. I believe that brings us to appointments. Are there any appointments?
Yes, I do have one reappointment to the Tarrant County Historical Commission, reappointing Nancy Tice.
Second.
A motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. And I wish to appoint James McClinton to replace Kristen Camarino on the Homeless Coalition Board.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We Need approval of the claims, including the addendum.
So moved. Second.
We have a motion and second to approve the claims, including the addendum. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Briefing item?
Judge, Commissioners, we have an item regarding a tax abatement for Rivian Automotive. Over the past few months, under the direction of the Fort Worth Chamber, the county and Parker County and Fort Worth partners have been working together on a project known as Project Terra. This project has been a national site selection to look for a 2,000-acre site that would house an electric vehicle manufacturing location and development and component manufacturing also. It would provide up to 12 million square feet of facilities at an estimated capital investment of $5 billion and a minimum of 7,500 jobs. This production plant is estimated to produce approximately 200,000 vehicles per year, and it would represent one of the largest projects in our state's history. As you may have read in the last week, the company has now been known as Rivian Automotive. They're an American all-electric vehicle manufacturer that was founded in 2009, and they're in the process of producing electric vehicles now at their plant in Norman, Illinois. They are producing an electric truck and an electric SUV. This company is supported by investments from many known companies, including Amazon and Ford, and they currently have a contract to produce electric vehicle delivery vans for Amazon. They have 7,000 current employees and are growing. So our site in Tarrant County and Parker County has been made it down through to one of the finalists in the site selection. And the location we're looking at now is a 2,000-acre site on the Walsh Ranch. As you can see here, it's within unincorporated Parker County and Tarrant County. The white area delineates the site boundaries, and then the Parker and Tarrant County line goes down through a little bit offset middle. So approximately 60% of the land area is in Parker County and 40% of the land area is in Tarrant County. It is in Fort Worth's ETJ, and the City of Fort Worth plans to annex the property after construction is complete.
Well, of course they do.
Under construction, though, they will be being constructed under the fire code. So any of the facilities that are constructed on the Tarrant County side will have to work with our fire marshal and be constructed according to our fire codes. Parker County does not, they have not approved the fire codes, so there would not be that need over on that side. There will be a lot of infrastructure improvements that will be required to the site. In fact, on the bottom, you can see a dotted line that it would be a Walnut Creek extension of the sewer line to the site. Commissioner Brooks' precinct has been approached to provide assistance because that sewer line extension will probably most likely have to go under the county road right now. So he will be working with the location. Should this happen, the City of Fort Worth will actually put the sewer line in, but they will need to access our right-of-way. There will be other utilities, water and sewer, that will have to come in from the north, and then substantial electricity will also have to be brought to the site. So as I've said, this site is now one of the finalist locations. Many things have brought us to this competitive advantage, including the availability of the 2,000 land acres and also the ability to stand up production quickly. The company has taken a full view of the project economics, including the long-term operating costs and the competitive impact. And we know that at least one other site that is under consideration has offered aggressive state and local incentives. And so it is going to be important that incentives will be looked at in this process, in the decision-making process. This is a little different than we normally do these tax abatements because most of the time we pretty much know where have been finalized, the site has been finalized when we come to you with the abatement terms. But at this point, we don't know for sure that we're going to be the final site. But in order to try to entice that location, the city and the 2 counties and school districts have come together to offer an incentive package that we hope will put us over the finish line for that location. As part of that incentive package, the company would commit to provide the $5 billion in investment in 12 million square feet of construction. That would be approximately $2 billion in real property improvements and $3 billion in business personal property improvements, with an initial completion date of 12/31/2024. The projected jobs would be tiered up, starting with about 1,875 jobs by the end of 2025, having a total of about 3,750 jobs by the end of 2026, and then the full 7,500 jobs by the end of 2027. These average salaries for the job would be approximately $56,000. For this commitment, the proposed incentives are the City of Fort Worth is going to look at providing an 85% abatement or rebate under an economic development agreement for 15 years. Parker County and Tarrant County would be offering a 70% tax abatement for 10 years. And then Fort Worth ISD and Aledo ISD are looking at utilizing Chapter 13 tax exemption program for a period of 8 years. The City of Fort Worth is also going to nominate the site for a Texas Enterprise Project, which will give them state rebates. And they will also provide for open space conservation offset and help the company with temporary office space when they locate here. So based on the 70% offer for 10 years for the Tarrant County, we are looking at that being approximately $35.8 million of abatement over a 10-year period. But during that same time period, we would generate revenues estimated about $15.3 million in new tax revenue. No hospital district taxes are being requested for abatement at this time. So, as we move forward, we're coming to you now to give you information about this incentive project. And what's different is in the last legislative session, they started to require that we have to give a 30-day notice prior to actually approving a tax abatement agreement. In order to move quickly to meet the company's time frame, we wanted to go ahead and get this process started now. So earlier on the agenda, under the consent agenda, we provided a notice of a public meeting to consider a tax abatement on September 21st. So during this time period, hopefully between now and September 21st, we are looking for the company to finalize their decision, and we will be working on a tax abatement agreement based on the terms we've provided you today, and we will bring that back for your consideration. At that time, we will have someone from the company to come here and address the court also. So if there's any questions?
Only one. The 3 entities involved has structured the incentives in a way that is calculated for us to win the deal, right?
Yes. And I will say, too, the way that we have calculated our estimated abatement is based solely on the percentage of property. So at this time, we don't know what the site layout is going to be. We could actually have more of the physical structures within our county, so our percentage of the actual value may be more than what we've anticipated here, but we won't know that until the site plan is actually developed.
This is a mega deal.
Big deal.
We
So-
need to be doing everything we can to win it.
All in.
Yeah, all in.
So we're excited about this, and hopefully I'll be bringing you good news in future weeks. All right, the next items on the agenda, I believe we do not have an update for you this week regarding fiscal year 2022 budget issues. And then on the item E, discussion regarding the second called special session, we have put this on the agenda now that the governor has opened the second called session. The House still doesn't have a quorum, so we have no report, but Mr. Schaffner will be prepared to report in the future should any action be taken. And that's all we have for you today. Thank you.
That will proceed, we'll recess, proceed to close meeting under section 551.071, 072, 074, 076, and 087 of the Texas Government Code.
We got enough people.
Well, yeah, but you're back there yakking.
What's that?
You're back there talking. Having returned from our closed session, there being no business to conduct at this time, we stand adjourned. Please note that we have 4.
And adjourning in honor of Dr. Maxwell Scarlett.
Correct.
Right.
We're done.
Anyway.